Hi there. Welcome to the Health Analytic Insights podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at healthanalyticinsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. So on this episode of the Health Analytic Insights podcast, I have the honor of interviewing Ron Beleno, who is an active advocate for dementia, caregiving, aging, and research communities. So thank you so much, Ron, for being on this episode of the podcast. And for my first question, I was wondering if you can tell us a bit about your background and experience as a caregiver and how technology has impacted your worldview.
Well, thanks, Alana, for having me today. And I'm looking forward to chatting with your community here. As for myself, I live in Toronto, Ontario, Canada. And I was a caregiver to my father that had Alzheimer's, which falls under the dementia umbrella there. My dad and my mom lives not too far from me, or my dad did live. My dad has passed, and they live about maybe 20, 30 minutes away from me. And being an only child, I chose, this was a conscious effort to care as best as I could for my father during the period that he was living with dementia. So for my dad, he was diagnosed back in 2007, and he peacefully passed away at home in 2018. So we were dealing with this diagnosis for over 10 plus years. That was part of his life near the end of his life. And one of my goals was to try and do my best with the support of the community, with friends, with neighbors, with family, to keep my dad at home as long as possible. Mm-hmm. And again, he passed away in 2018 peacefully in his sleep. That's not rare, or that's a little bit rare for someone with dementia. Many times they may eventually end up in a long-term care just because there's so many challenges to care for them, or they might be passing away in the hospital due to some complications in their health. For him, it was one of those, dream scenarios that many of us might hope for. He just passed away in his sleep. Mm-hmm. So, but it was challenging. So I do a lot of work around this space, around how do you care for someone at home in the community as best as possible. And technology and all this cool stuff kind of are part of what I talk about a fair bit.
And so how important do you feel patient advisory groups are when it comes to driving health tech innovation in hospitals and other clinical organizations?
So I'm quite involved with patient engagement and shared decision making, the ability for the voice of the patient, specifically the patient, and their caregiver to be at the table, to have a say. It's their lives. Yeah, in the end, it comes back to their lives. And sometimes we forget this in the healthcare system, that people are focused on their job, their work, their discipline of what they're doing. And in the end, all of this has to channel back down to that patient, okay, and that the caregiver. So when I say the term patient in this conversation, and I don't say the word caregiver, they go hand in hand, in my opinion. Okay, it could be one or both, and you have to have their voice. Okay, and I believe there's a shift around this. Many healthcare systems already, and Canada's really good at this. In all honesty, as much as I kind of said, you have to have that. Canada community in many areas, from research to healthcare, are having patient and family advisory councils. In the research community, they are not just waiting to get some advisory from the patient and family halfway in the research. They're actually having them sit, on their advisory, as an actually equal partner, okay, at the very beginning, and even designing the research as well. So that is kind of key. Some of the audience, I believe you have, Alana, are very technical mindset. I come from that mindset as well. Step number 1 up to step number 10, right? Mm-hmm. And I always kind of joke with people. I said, why would you bring someone in, who you're really, doing this work for at step number 7, 8, or 9, and they're going to say, oh, back at step number 1 or 2, you could have done this, right? So that's why it's quite important to have them at the table. I would always suggest have more than, one. Don't always trust one person. Don't just have Ron at the table. Have Ron plus maybe 2 others with different perspectives. But it is quite important. Canada's doing great in that space. And one thing I do need to share is that, the communication is where we sometimes have that gap from all sides. Okay, is that from the patient and the caregiver, we usually and always, for the most part, start with the story. Okay, we communicate through story. If we didn't have the story, okay, if we weren't having our challenges around health and living, then it's something that, where would we learn ourselves? What's our experience around it? So usually we start with a story, and it's a personal story. And it's a question of how do you translate that story, okay, to the data, the golden nuggets, that information that the health team or the research team requires to do their job better. So that's where we all have to work better together. And but you have to have them at the table first. So that's why I encourage patient engagement from the very beginning.
And that's definitely been a thread I had an interview prior talking about user experience design in healthcare. And you can't just build any technological project, just have this idea, build it and they will come. No, you have to really have people at the beginning understanding their pain points, having conversations with people, and really getting to the heart of what their issue is. You can't just make assumptions. And
Exactly.
one of the great experiences that I had working at Holland Bloorview Kids Rehabilitation in Toronto, that all the research that we did in my co-op position was always patient-centered focus. So it was always, an issue that a patient had, and then you build from there. One of the really cool projects that I wasn't involved with, but I saw was, an interactive patient waiting room. So a lot of patients, they can be worried about their upcoming appointments, especially if they're children. So, designing this interactive waiting room that can kind of take them away from their issues for a second and just, focus on play, I think is just an example of a lot of the amazing work that, hospitals in Canada are doing. So I definitely do see that in Canada, there's a lot of patient-centered focused research. And I hope it definitely continues, but you're definitely right in terms of need to communicate.
Yeah, and the key word, so for many, you kind of said it there, Alana, is patient-centered. Okay, that piece is, there's been different schematics and diagrams of the healthcare system. Here's the hospital in the middle, and here's the outside services, for example. The better models, in my opinion, is not that being centered. It's the patient being centered in the model, and everything around the patient is what we have to deliver and bring towards. But sometimes, depending where, and again, as I said, Canada's great at it. Can we get better? Yes. But that concept of, in some areas, it's still not the patient centered. It's around, the healthcare system first or the hospital first. And I get it. It's just one of those, in the end, you remove the patient, you remove the caregiver, really, there's no work for all of you if they're not part of this picture. Okay.
Right.
They have to, they're always there. They're the key piece. So that comment just said patient-centered focus or patient-centered care, patient-centered whatever, okay, services, patient-centered is a key piece. So yeah, great.
Yeah, I think that just having diverse perspectives are so important. Sometimes, you can be so in the weeds that you can't see different perspectives. And I think that having patients giving their perspective can really breed a lot of creativity and breed a lot of solutions to issues that people might have. So I think, as you're saying, really having that patient in the center to whatever you're doing is definitely the ideal situation.
Yeah. So Elena, just one thing there. So one thing that I've been working on with the team, I know your audience, here on a podcast, it could be worldwide, okay? But here in Ontario has a model, a healthcare model that's kind of shifted in the past few years called the Ontario Health Teams, right? So they're kind of putting focus on the community, the more local. So a health team, Ontario is quite big, our largest province with population there. And to create a healthcare system that's standard across Ontario for someone that is in a very urban environment like Toronto versus a rural community isn't the same thing. So this whole term around Ontario Health Teams of getting a little bit more center focus on the community, okay, on that specific health team in that community has been changing. And I'm a supporter of that model. But to go even further, okay, as you keep digging down, doing a deeper dive, well, now you're in the community and you keep going deeper into the specific organizations and agencies, and even deeper down to eventually the patient, back to the patient. Okay. There's this thing called GAS, so GAS, okay, and it's like goal attainment scaling. And because I do a lot of work around aging and older adults, some work around frailty, some work around in that space. There's a couple individuals there like Dr. Kenneth Rockwood and Dr. Paul Stoley, and a few others that have done work around this thing about goal attainment scaling, which is how you assess based on the patient's goals, okay, versus the community, like the healthcare's goals directly. So there's a lot of that. Again, you can't have that unless you have that patient at the table. And so I love the model where it starts with the patient always. So yeah. Sorry, I'm going to throw in here, and you can tell I enjoy chatting here. This is not just healthcare. This is even for the designers there. Okay, so I have spoken to, again, coming with a little bit of an engineering technical background myself. I have spoken at your previous university there in Ottawa, I believe, right? University of Ottawa, Carleton. Right, Carleton. So I've spoken to a biomed class one year, and Dr. Bruce Wallace, he brought me in.
Oh, okay.
And so Dr. Bruce Wallace, that's another conversation I advise with a sensors, SAM, the Sensors and Analytics, forgetting about the M. There's so many acronyms in this world, over there at Breer Hospital. But he, and they do stuff around aging and sensors in the home, but he did invite me to one of his classes. And, I know it's sometimes difficult for the engineering community, and I come from that space as well a bit, to kind of wrap their concept going from the technical and designing and all that to the individual that they're serving for, that sometimes they forget that. So my quick little story is that, I was judging a hackathon one time here in Toronto, 500 competitors. They were like about in teams of maybe 5 to 8 per team. And one team that had all engineers did not ask the whole weekend. It's over 3 days feedback from me as one of the advisors or any advisor until the very last day when it was like 2 hours before judging. And they said, what do you think of this, Ron? I said, oh, yeah, okay. You created this whole app to help someone with dementia, okay, with their grocery list. And there's these buttons. That's cool. But then I said, a piece of paper with a checklist of 10 lines works just the same. Okay. And they kind of looked at me and they said, yeah, but this is cool and it has these buttons and that. I said, yeah, but in the end, still a piece of paper can do the exact same thing. And I kind of challenged them as I'm saying, it would have been nice if you had me like on day one and I could have kind of guided you in some other way. So that's just something as an example that this goes at all levels, not just healthcare, but also in design and engineering.
No, absolutely. Absolutely. Thank you so much for that insight. The next question is, since we kind of delved into it, can you talk a bit more about what age tech is and how has age tech helped with the concept of aging in place for seniors? And where do you see room for improvements in this field?
So age tech, we'll start with the second half of that word there, or tech. It's technology. Okay, and for me, I always try to simplify it because technology for a community, for many, it's a sexy word. They get excited. They say, cool, it's something neat. Okay. And then there are those that, I've done presentations to many communities, especially caregivers and older adults and those living with dementia. And some of them, it happens to be a talk on technology that can help you in your life, that when I'm presenting, some of them right away, they says, I'm just here because, my wife brought me here and I'm really not into tech. I'm not really interested in this. And I said, oh, you don't have to be, right? I'm not here to tell people, that you have to have technology. Okay? But I actually tell them, reframe it and don't look at the word technology. It's simply a tool. Okay. Right. It's just a tool to accomplish something or to overcome a challenge, a barrier. Okay. So that's when I hear the term tech, I always say you could just simply replace it with tool. Okay. And technology could be low tech. It doesn't have to be something that needs to be plugged in, okay, wired. It needs batteries, that it has lights and buttons. Okay. To me, the plumbing system is technology at one point. That's just like the internet to me. It delivers things and gets rid of things or goes back and forth. So that's a tech piece. Age, just happens to be the audience that we're dealing with. Okay. And age doesn't mean old necessarily. Okay. Although most will gravitate towards that. Age is simply aging. Okay. As we age, what tools, okay, or what technologies can we bring to the table to help us age better? Okay. And that could be aging for that individual that might be having challenges in their lives. It doesn't have to be something as challenging as someone living with dementia. Okay. It could be just someone that's aging and right now they have difficulty getting to the grocery store because maybe mobility issues. Okay. That aging, the challenges here in Canada when it's winter. Okay. Again, simply getting your groceries. Okay. Well, there's some technologies that we could call them tech or tools. You could have food delivered now. Okay. Which was there before, but it's better now. You could use your smartphone, okay, to place these orders. We could have in some places, you could have in rural communities, you could have maybe a drone deliver your supplies, things like that. So that's what age tech is in its definition: is any tool that can help someone as they age or their care team. Okay, so this could be the caregiver helping the caregiver as well. So that's what age tech is. And the second half of that question, Alana, I was spending so much time talking. What was that again there?
Oh, no worries. The second half was how does age tech basically help with the concept of aging in place?
Okay. So related to aging in place. So I gave a few examples, right? Right now, the aging in place. And especially now at the time of this discussion we're having, we are dealing with the pandemic. Okay. And it is ugly. It's going to hurt a lot of people. There's a lot of pain that's going to be happening in many people's lives. Okay. So that I need to acknowledge. Okay. Then there's the other side. I'm always that one that's okay. Well, even in the ugly times, where can we find, those opportunities? Okay. Those pockets, those windows of opportunities. And it's also known in policy when you're changing policy, like, okay, the opportunities are there now that a spotlight has been shown in how we live at home. Okay. And especially in aging, the challenges of how people age and how we need to support that even better. Okay. Many that would not have experienced this or know about this without the pandemic are now discovering what it means. Okay, I have to be at home. Okay. And I'm challenged of being at home, and I'm living and aging at home now. Okay. And I can't get out, or we can't do these things. Our choices are limited. Okay. The choices are there, but many of are following, the guidelines, what's out there, to stay at home, but then that limits us from socializing, things like that. So how age tech can help, there are many challenge sets that it could cover. I can't go through all of them right now, but for example, one group I'm with is a group in Canada called Age Well. Okay. So people will look up Age Well. It's Canada's aging and technology network, which consists of researchers, the academia community, heavy on that, that's doing, data, health informatics, all that fun stuff that you love around aging. But then it also consists of us, the caregivers and the older adults. Okay. I chair the caregiver and older adult advisory committee across Canada on that. So we have that voice. We have innovators, okay, that are designing, okay, for this. As much as we get all the research, that's great. But if it doesn't get into the hands of the patients and their families there, it's of no use. So that's one piece, the innovators. We have policy leaders on that. Okay. On the East Coast is where their lead policy hub is, called APTA. So all that together, okay, if we can get some of these technologies into someone's home, okay, into their lives, or the policy can change, then you have a higher chance of succeeding. Okay. And with that, coming back to AgeWell, if someone were to look up AgeWell, look up the 8 challenge sets that AgeWell has. Because the one thing is we kind of broke it down into challenge sets. And with these challenge sets, they actually focus on the areas that many might be dealing with. For example, we're dealing with mobility and transportation. I already spoke about that. Staying connected, cognitive health and dementia, autonomy and independence. Those are just a few. And that is just something where there's so many challenges, and what are the tools that can help us overcome them? Age tech is not, again, the solution for everybody, but it is one tool that can help improve people's lives. The one that I like to look for is quality of life. Does it support quality of life?
Absolutely.
Okay. So that's my thoughts around age tech and how it can help in the home. Yeah, I could go over like thousands of examples, but yeah, we won't have time for that today.
And I like what you said about how you highlighted how I think the pandemic also really highlighted some health technology aspects. So, like, we see the adoption of telehealth. How does that impact seniors in terms of allowing them to stay at home and the ability to get groceries delivered straight to you, and even some of the changes that we made to our society. So, allowing seniors, to get groceries early on, things like that. You hope that some of these health technology things can kind of stay in place and have a positive impact. But yeah, we'll definitely have to see moving forward how the pandemic has really changed a lot of technology and healthcare and how that's made an impact. I also like what you talked about, how AgeWell has kind of divided up into those 8 different layers, because I think that there's so many things as you're talking about, like cognitive issues. I think that there's a lot of cool apps out there that can help, build up, that can kind of gamify certain things and allow you to build up your cognitive skills. I think there's a piece of the caregivers. Caregivers can be, exhausted. And I think it's important to add them into the conversation. But I think, yeah, there's so many different layers that I think technology can help when it comes to seniors and aging in place.
So to add to that, you actually, a side little note, you said one keyword that I love is gamify. That's another podcast that one day we could talk about. I podcast the game of care and dementia. So it's kind of divide and conquer how, again, I'm wearing the hat of a caregiver many times, or coming from that voice. And I talk about how can we become a better calculating caregiver? Okay. So there's this chess game that I've used as an example of how you care. Which moves do we make for the better results? But coming back to the age tech conversation, the one thing that when I look at age tech, some of these solutions are not fancy, right? It's just using the tools and like years even before the pandemic, I was already doing this 5 years ago. I was doing this thing called teledining. Okay, teledining meaning just getting on this thing called Skype. Okay, it's still out there, but most people aren't using Skype. Well, they're using some of the more common platforms now, like Zoom and whatever's out. There's a whole list there. But the back then, I was using that to have meals with friends, those living with dementia that weren't in my community. Okay, and that could be just once a month. But it's not about the technology. It's like once you figure it out, it's like, okay, now how do I make this more impactful? Well, I would have a friend in Welland, Ontario. Okay. And we would just get our meal together and I would sometimes bring in a researcher. Okay. Not necessarily to do research, but just to have a meal together. I love this term breaking bread. That's what I use as my hashtag a fair bit. But what happens is that the technology is forgotten. And that's something to the audience I want them to understand is that great technology, in my opinion, once you figure it out, how to utilize it, that tool, you forget about it. Okay? That it's quite simple. And it's really what's that impact that's happening. It's allowing that communication, that ability to smile, to laugh, to cry if need be. Okay. Mm-hmm. So that's just one piece. And again, I use it as well as an example of back then. It's popular now. People have figured it out because the pandemic has pushed it faster. People have to figure out how do I use remote care. Okay. But again, this for me was like 5 to 8 years ago, starting this for myself, is that for my dad, when he would be at home and my mom would be stressed, because of some of the care she was providing, I would say, Mom, you have a rest. I will care for Dad remotely by having a meal with him online or checking up with him using some sensors and cameras in the home. So some technologies. Okay. Mm-hmm. For those listening, some might get scared when they say you have a camera in your dad's home. That's a conversation that we can talk about. Ethics, privacy, all the conversations, all the scary stuff about technology has to be discussed. But the return was higher to have those things. So having my dad be safe still and still have a quality of life by having someone remote care for him while my mom could have her sleep, mm-hmm. could get respite, could do whatever she needs to do. That's my way of spreading the stress. Okay. And that is something I talk a lot about when it comes to care. Okay. And aging. When you can spread the stress, you increase caring success. Okay. Meaning that spreading that stress could be with another person. So it's not all on my mom caring for him at home, but I could help. But I also got my aunt in California. okay, and a friend who's a nurse, a loving nurse, Beth, an artist. She actually lives in Ottawa now, but she lived up in Sudbury, Northern Ontario. Would check up on my dad. She had permission, and they would spend like half an hour with my dad, every once in a while. So we're spreading it out. We're spreading that care. So I had remote caregivers. In the end, it wasn't about Skype. Once that was figured out, it was about that interaction. So that's just I wanted to say that technology in the end, you kind of forget about it if it's done really well. It's about what it's delivering.
Yeah, absolutely. The outcome of it. And yeah, that's really, really great insights.
Mm-hmm.
So this has been just such a great conversation. But my last question is, what future advancements would you like to see in the field of age tech innovations?
Okay. So as we're moving forward, I still think we're still at its infancy, okay, around age and tech, and combining together. A lot of it is maybe not brand new innovations per se, which I will give a comment on that in a second, but it's more about what do we already have or what can we just kind of upgrade a little bit more or upcycle, for me, for those that, without getting so technical here, like a lot of people understand the recycling, reusing something. Okay. Yeah. You reuse it, you put it in the recycling bin and it's converted back into something else. Okay. Whereas upcycling is using what you have and taking it to another level, maybe using it for something that you didn't realize that it could be used. Back to my example of Skype back then, people always thought virtual tools like Skype were for meetings. Okay. It was for me, it was, you upcycle Skype. So it's used for care. Okay. So it's no one really thought that concept of how do you use virtual communication tools for care. Now we get it. Okay. But even back then, I remember I got the invite to come to Microsoft back then in Washington State. And when I was there, that Skype team kind of says, Ron, how are you doing this with care? And it's not just calling someone on Skype, but I even had it remotely. So it was hands off. It was an auto answer feature so it made it simple. So my dad doesn't have to answer the call. Okay. So people who are living with dementia, families will get this, that sometimes you would call someone, the person with dementia, and they don't answer the phone or and stress starts happening, that buildup. So upcycling that, tool to say, hey, I could use this to automatically pop in on my dad, okay, safely and have a conversation and check on him. That is an example of upcycling something that was already there. Okay. So sometimes it's like we already have the tools out there. It's just MacGyvering things. Okay. So, there's two MacGyvers, old MacGyver back, I think from the 80s and the new MacGyver. Personally, I am a fan of old MacGyver because he could take Scotch tape and a pencil and save the world. Whereas new MacGyver right now needs a smartphone. Like he has so many tools to his advantage, right? But that thinking is what I'm suggesting to many. But then the other thing is, what do I want to see moving forward? In the home, a lot more ambient solutions, meaning that you're not even aware it's there. But we have to deal with, okay, another conversation another day, the safety, the ethical issues, the privacy, the security, okay? Because, if we can be confident in that, that's great, okay? But that ability to just kind of say, in the home, they're there not to spy on you, okay? If you can control it yourself, and it's secure and it's safe and it's just for you, let's say, then it's supposed to help you in your life when someone might have a fall, okay? Or there's someone at risk of falling, okay? As an example. That's where I think we got to continue doing the work. Mealtime. That's the one I would like to say, is that I think we can do a lot more around mealtime. Okay. Everyone needs a meal. The meal, the kitchen and the bathroom is where I'd like more work done. If anyone's working in that space, give me a shout. I'd be interested in discussing what you're working on or what you want to work on.
Do you mean mealtime? Do you mean like even like the utensils that are being used, or?
Not necessarily. So there's so many families as you age that just preparing the meal. Okay. So technology, in the end, for me, the challenge is I love using the third letter, the third number, just as I'm born March 3. 3 is my number. The third letter happens to be the letter C, caregiving. It starts with, it's the letter C, the third letter. But the ability to care in the home as someone ages, the challenge, another C word is right there, is that in the kitchen, choices start being lost when you age. Okay. And I play this game when I'm presenting to classes, many times in university classes. I've done it probably 24 times. The engineering class was the odd one. I'm going to let you know there, Elena. The one when I went to the engineering class at your university, they weren't consistent with all this game with all the other classes I've done. And it's a survey, and I would say it's a game of choices. Okay. And in the game, I'd say they don't know where I'm going with this, but I asked 3 times, choose. And I give them a list of choices of the foods that I give them. I would say, first time I give them this choice, I'd say, choose porridge, toast, eggs, and a carrot. And then they make their choices. Then later on in the game, I say the same thing, choose. Peanut butter sandwich, sushi, pizza, hamburger. I would also say rice. And so I had this whole list of maybe 20 items to choose. Okay. So they have them. And then later on, I ask again, choose, and it's food related. And then I only give them maybe 5 or 6 choices. And eventually I explain that's actually sometimes the lifespan of your meals. Okay. When you're young, you have limited choices because you're given what you're given.
Mm-hmm.
Okay? But when you get into that, age, okay, my guess is it could be from 15 to whatever age, okay, as old as you can be, you then, can make as many choices as you want. But then many times as we get further on in life, because of challenges, that could be health challenges, that could be, you're diabetic. Some of you might lose some of your teeth. Okay. So the type of food you eat, okay, you might end up maybe in a healthcare place where this is only the choices on the menu today. Right. Mm-hmm. So to me, this is all about choice, and mealtime is something I use as an example. And in the kitchen, that becomes a challenge as people get older. And so many families I know are afraid to have someone cook, simply as even make their meal because they might burn the place down. Okay. Okay. So it's not just the utensils, but it's how someone prepares food. And I'm dealing with families and saying, is there a microwave, Ron? Is there like something we could use? So it's just one button. Okay. So that my mom will not burn it. That process to get that food from the freezer, let's say it's frozen food, you have to take it out of the box, you have to unwrap the plastic, you have to put it in, you have to, instead of putting maybe 5 minutes, someone accidentally puts in 50 minutes, and we've had fires. Okay, there's enough. So that whole process, there are failure points. And when it comes to design, I actually don't design based on just a solution. I actually challenge everyone saying, or I will challenge them, where are your failure points? If you don't understand where your failure points are, where it's going to fail, then you don't understand the problem and the challenge enough. Okay. How are you overcoming that? Okay. If you're putting 10 buttons on that, that's great. All these functions. Okay. But then that one button is a failure point, that it's one button too many. Right. So simply taking something out of the box could be a failure point. Okay. Unwrapping on the frozen meal, pulling the plastic off is a failure point. Okay. So that's what I look for, is how could we simplify and reduce some of these failure points? I'm not asking for perfection. I'm just saying, how do we make this better? And the kitchen is one where there's so many failure points, okay, mealtime. And in the bathroom, there are so many failure points. And I'll leave it at this, where if someone just wants to think about this, the every single step, count how many steps it takes to just go in and have a bath and dry yourself and then put your pants back on. Okay. It's not simply 10 steps. Okay. Count every move you do that you're doing, and you will now say, okay, any one of those is a failure point for someone, okay, who might have a challenge. Okay. So that's just something to think about.
That is so interesting. I never even thought about the whole mealtime prep, and not all of us just want to eat Soylent for the rest of our lives. Like, there's so much culture and enjoyment that's surrounding preparing food and what food means to people, and having that autonomy to create your own food. So that is so interesting about all the different fail points that can be involved with mealtime and bathroom time. So yeah, I definitely hope that we can get some more research around this area for sure.
Yeah, definitely. Well, hey, that could be another podcast on its own. Anything around food there, Alana, you got me in that. Okay.
Same food is everything.
Yeah. But there's so much learning. Again, you brought up like culture. Okay. So the culture piece, right? And this is not just work on technology. Could be on work on just those, I have a little bit of a culinary background, right? I also, went to culinary school just for fun. And it's a cultural piece. My family's Asian, and growing up in the Philippines. Well, my parents grew up in the Philippines, but just, diabetes is a big challenge. Okay. So, there's one team that I'm, collaborating with, advising with, called My Palate. And they're doing some work related to culture and food. Okay, especially those that kind of are told, "Oh, you're diabetic. Now you can't have this food. These ingredients." Okay, so how do we adapt the culture, their food that's from their culture, so it is adaptable versus saying, "Okay, you know what? You're diabetic. Now go have a salad." Which is not common for the Asian community, right? Go have your greens. So there's that's technology as well, in my view. But yeah, there's so many analogies we could take from mealtime. Okay, just you could reverse it, or not reverse it, but you can just say, I gave you guys the challenge of how you have a bath. Count how many steps it takes just to go and have your dinner, okay, or cereal. Every step from pouring the milk to getting the bowl to taking it out of a cereal box, if that's the case, that sitting down, keep going on, and you'll see where the failure points are for someone as you age. And that's where we could work and find solutions.
Absolutely. So thank you so much, Ron, for this great insight. I've learned so much in this podcast episode, and hopefully we can collaborate in the future. And thank you so much.
Well, thanks, Elena, and all the best with the podcast, and hi to everyone.